Today we're charting a course that really has the capacity to transform the provision of mental health care in the state. It's no longer acceptable that the services we may be providing at DPC are based on best practices. That's not really the issue. It's important, but it's not the whole issue. The question now is whether we can provide those services in the community. Can we support these individuals where they live and where they work?
More than a decade ago, in its landmark ruling in the Olmstead case, the Supreme Court said that under the Americans with Disabilities Act, states must serve individuals with disabilities in the most integrative setting appropriate to their needs. I was working at the Department of Health and Human Services for Secretary Shalala the day that decision came out. I remember it well because I was her point person on Olmstead. And that decision was hailed by many in the disability rights movement, including leaders like Alison Barkoff, whom I have been able to persuade to come to the department, and Sam Bagenstos, who are really the two architects of our Olmstead strategy in the department. It was hailed by many disability rights advocates as the Brown versus Board of the disability rights movement. And the opportunities that it provided to ensure that we do not segregate unnecessarily individuals with disabilities in institutions, the imperative, the legal imperative and the moral imperative of the Olmstead decision have guided our work in the department. And today's agreement will bring Delaware into compliance with the ADA and the Olmstead decision by building a comprehensive community-based mental health system here in Delaware.
First, we want to ensure that persons treated at the Delaware Psychiatric Center and similar facilities have the ability to be placed in less restrictive, medically appropriate settings with identified individualized supports. To that end, the agreement requires that we work with each individual admitted to DPC toward developing those individualized recovery plans. We will use specialized transition teams to work with each of these individuals to identify the best community services that will meet their needs and further enable them to sustain themselves within their own communities. Second, we will work to prevent unnecessary institutionalization by developing a strong, robust, statewide mental health crisis system. The agreement requires that we maintain a 24-hour, 7-day-a-week crisis hotline and mobile crisis teams that can respond across our state.